There's good and bad news in a report tonight from the American Cancer Society. The good news, fewer people are dying from the disease. The bad news, cancer among women and young adults is rising at an alarming rate. CBS's chief medical correspondent, Dr. Jon LaPook, is here with us to help sort it out. John, so good to see you. You know, it is striking when you look at this report, 4.5 million cancer deaths prevented since 1991 by doing things like stopping smoking, early detection, and better treatments. So what are some of the things, though, that people can do now to further lower the odds of getting cancer?
Well, you know, the details of your family history are a really good place to start. If your mom had quote unquote stomach cancer, was it really from the stomach, or could it have been colon or even ovarian, which would totally change the approach to screening? So try to get medical records whenever possible. Cervical cancer is preventable with the HPV vaccine, but less than 40% of eligible children got it in 2022. But by far, the #1 modifiable risk factor is smoking, which accounts for about 30% of all cancer deaths.
Well, it's interesting that you mentioned that because the report today says that lung cancer is still the #1 cause of cancer death. So if you're a current or a former smoker, is there a way to screen for cancer of the lung?
You know, there is. A government task force recommends annual low-dose CT scan for people 50 to 80 who smoked at least the equivalent of a pack a day for 20 years and either currently smoke or have quit within the past 15 years. But less than 20% of those eligible are actually screened. And a study found less than half of primary care providers, less than half, were aware of the recommendation. So this is an example, a perfect example of how important it is for patients to educate and empower themselves so they can bring up these kinds of questions with their care provider.
Such good information. Get screened if you can. Dr. LaPook, thank you so much.